This is take 7.
Start one side of the back, figure eights. Forearm stroke. And slide back down. How's that feel?
Good.
Cross fiber forearm stroke. I'm going to transition to a knuckle stroke. For the most part, most of the strokes in my routine are done much more slowly than what you guys do them. This is a soft knuckle stroke. I'm not making a fist. I'm putting pressure down with my forearm onto my knuckles, but my left hand is not flexed. We can do that again. A lot of times I'll only do that stroke once. And it's really good for bringing blood supply into the paraspinal muscles. This stroke would be substituted for your crisscross thumbs and straight thumbs. I'm going to transition into petrissage. And then on this return stroke, I'm going to go back into my figure eights. And as you do this, you'll notice the body shift from one side to the other. I'm actually using quite a bit of pressure to do this.
And is that the pace that you go in your routine?
Generally. Transition. I always keep one hand on the body, and I always keep my hands moving. I try to never let them stop moving. Now this I'm really going to lean into. I'm putting quite a bit of my body weight down on her back. You can see her skin stretching as I go. When I work, I generally don't use a lot of massage cream because that friction is the rough equivalent of a myofascial release. If it's done slowly enough, it's going to stretch the skin as I go. Again, notice that most of the movement does not come out of my upper body, it comes out of my legs. That's why I was always big on body mechanics with you guys. I can do this for long periods of time because I'm not really using my hands for this. I'm not really using my upper body. For the most part, my upper body is locked, and it's my legs that are doing the motion. You can actually get a pretty good circle going on this one. Transition back into the figure eights. And I'm going to go back to the side that I started on. And I'm going to start my specific work. I'm going to start in the upper division of the trapezius. I'm going to do a really slow thumb stroke in towards the spine. If you find something in here, you can work it out. But generally, the strokes that I use are so slow that it works the knots out as I move. So I don't really have to stop and hold them. Everything stretches out inside as I'm working.
Are you holding with your left hand, are you holding pressure down, or are you just holding the skin in place?
No, I'm holding some pressure down, but more than anything, I'm keeping the skin from sliding towards my right hand because I'm pulling as much as I'm pushing. Almost everything I do has some sort of myofascial application. Rub it out a little bit because that was a specific stroke. Now I'm going to do a thumb stroke down one side of the spine. This is an amazingly beneficial stroke because you're actually contacting every single spinal nerve root. So you're affecting everything in the entire body. If you watch carefully, about the time you hit T9 or 10, you'll see their breathing rate change. They'll actually take a deep breath. This really is the speed that I do this stroke. And I can feel the muscles along the spine releasing right in front of my thumb. Before I ever hit them, I can feel them release. Right about there, I'm going to shift and I'm going to go to the other thumb. I'm going to get a good pull with my right hand. The left thumb is going to go up till it hits the iliac crest, and then I'm going to pull across the top of the iliac crest just as slowly as I was running down the spine.
Same pressure?
Same pressure. Different pressure, but same amount of pressure, different type of pressure. I'm using a different part of my thumb. Yeah, I'm using the phalangeal, the interphalangeal joint, as opposed to the end of my thumb. That would be the joint between the phalanges. Just a little bit, smooth it out. And then I'm going to come over to this side. Again, hands keep moving while I'm transitioning. For the most part, I don't preset my pressure, I preset my intent. And my intent is whatever pressure is perfect for this body and mind. Generally, I don't ever hurt people as long as my intent is that the pressure is perfect for what their body can handle and what their mind thinks is appropriate. I do the spinal thumb stroke one side at a time as opposed to both sides, the way we've been doing it in class. Because when you're trying to do both sides at the same time, you can't contact both of them because you're stretching the skin over the spinous processes. You can't get in as deeply as you can if you do it this way. Also, based on the way the facet joints in the spine are angled, it's a lot of times, and I'm not going to say all the time, but a lot of times more appropriate to go down the spine with this stroke than up the spine. There she goes. I like this routine because I don't have to use my hands a whole lot to do it, at least not specific pressure. And it is so much simpler. There's only like 4 strokes. Okay, now we're going to smooth out. The only difference to my routine is this right here. going to push in along the top of the shoulders, and then I'm going to pull down. This gives the trapezius a little bit of a stretch. I like that. She likes that. And then my last stroke is going to be lighter. And come up. That is my back routine in its entirety. One other thing that I haven't shown you guys that I wanted to show you in this class is nerve stimulation. We haven't really talked a whole lot about that. If you have someone that has an injury that you can't really do specific work, especially anything deep, or if you can't even touch them, if there's inflammation or too much pain, nerve stimulation is something that you can do to almost anybody. As far as I know, there isn't any contraindications. It is very, very light work. The fingertips barely touch the body, and you basically just drag them across the surface. Remember Hilton's law? Same nerve that supplies the skin, supplies the joint, fascia, muscles. Okay, so in order to affect everything underneath, all you really have to do is affect the skin. This is an interesting technique because after you're done, they'll still be able to feel it for a few minutes. That's pretty much all there is to that. How'd that feel? Kind of creepy, huh? Yeah. Okay.
She likes creepy.
She likes creepy. All right, we're going to move on to the back of the legs. I always cover up their back so they don't get cold.